it's great to see a very dynamic and engaged dialogue between policymakers and society, the young society, about a very important topic like health. And for us as a company broadly based in healthcare, it's fantastic to see that we can contribute to stimulating this kind of new approach to policy making.
I had the chance in last December to meet them already, and I think it was great, the outcome of their work, and that's why I really was happy to be invited again. And I think it shows that there is a lot of interest and there's a lot of innovation in their ideas, and that's just what we need in Europe.
Most important thing for me is education of the professionals to use the tools that new technology provides, and we'll try to work on that even more.
What's really important is to put the science back at the center of policy making, and the European Health Parliament can help us do that because we have a lot of scientific professionals in these panels, and so politicians really have the right to their own opinions, of course, but we have to respect the facts, and I think the evidence-based policy making is really crucial also for members of the European Parliament.
The main kind of mental shift that I think we need to do, or the main thing we need to promote, is the idea that we're paying for our healthcare. We need to have data transparent about the outcomes that we're achieving with the money that we're paying. So that idea of transparency, I think, is essential to push the discussion along.
It's important that people realize that healthcare is really a right for everybody. You cannot leave people apart, separate. So that means that healthcare had to be affordable for everybody. That doesn't count not only for Europe, that counts for the whole world. So that is our goal, that everybody in the world gets the healthcare he needed.
The problem related to immigration, it is a new one, but have to be clear that the European citizens have to be better informed on this issue, and it is important also that young people discuss the issue.
Globalization is a reality, but what we see in sudden migrations, particularly the recent refugee crisis, is whole populations move. It's not specifically a health threat, but their individual health can be threatened, and we need to think about it in advance.
Our major surprise today was the reaction of the public in our discussions and our debate in the European Parliament, which resulted in having the European Parliament trending #1 in the Twitter sphere in Brussels. And we are delighted that people are reacting and they are joining our movement.